Namaskara and welcome to the UK Bansanga Presents The Specialist, bringing to you expert insight from diverse professionals. This is Abhinandana Shetty. Today we are going to have an honest conversation about women's health, something we all care about but don't talk enough. From screening myths to menopause, everything in between. Today it's all about awareness, clarity and empowerment. And to guide us through this today, we have a wonderful guest, Dr. Shabari Hosur, who is highly experienced GP with over 25 years of practice. Dr. Shabari Hosur, it's our pleasure to have you with us today.
Hi everyone, this is Dr. Shabari Hosur. I'm one of the GPs working in Cheltenham. I'm a GP partner in the largest training practice called Western House Practice. I'm also the medical director and one of the 4 founding members of Cotswold Private GP Service. I would like to take this opportunity to thank Abhinandana Shetty and also the UK Bansanga Committee to have invited me to give talk on the topics of women's health which are covered in primary care. A little bit about myself. I did my MBBS from MS Ramaya Medical College in Bangalore. I directly came to UK after that. I always wanted to be a medic, so I did Cardiff medical rotation and achieved MRCP. Following that, we wanted to extend our family, have the second child, then moved over to general practice. I did Kent Sussex survey rotation and achieved MRC GP. As a GP, you tend to see a lot of women's health conditions. Hence, I completed my diploma in Faculty of Sexual and Reproductive Health in 2014. I'm a GP with special interest in diabetes. I always was interested in long-term medical conditions, which we manage in primary care, like diabetes, hypertension, dementia, heart failure, etc. So I completed my postgraduate diabetes diploma from Cardiff University. Doing the Cardiff diploma gave me the confidence to apply for some clinical leadership roles. I was fortunate to do the primary care clinical lead for diabetes role for the Southwest Cardiovascular Clinical Networks. Following that, I was the clinical lead for NHS Diabetes Prevention Programme for Gloucestershire CCG for 6 years. I have had the opportunity to do the medical director role for an organization called Medvivo, which is now called Health Hero. They provided GP out of hours or integrated urgent care service to 1 million population across Bath, Northeast Somerset, Swindon and Wiltshire. Since 2020, I have been a GP partner in the largest practice in Cheltenham called Western House Practice. In 2025, with the vision of increasing the access of primary care to patients, giving them continuity of care, and to provide patient-centered high quality of care, we with 3 other GPs, we have opened Cotswold Private GP Service, where people who are not registered with a certain practice can also access primary care appointments, which includes weekends.
Awareness and myth. Many women delay screening due to fear or misconception. What are the common myths about breast and cervical screening you would like to correct?
I think that's a very interesting question, Abhinandana, because a lot of screening programs are coordinated in the primary care, and it's important for people to know about these screening programs and engage promptly. Important facts about cervical screening. Cervical screening is a national screening program where women from the age of 25 to 64 are called for a smear test every 5 years. Everyone with cervix, including trans males and non-binary, should have a smear test done. During the test, a small plastic speculum is introduced into your vagina to locate the cervix. A small sample of cells is collected and sent to central labs. The sample is checked for certain types of human papilloma virus that can cause changes to the cells of your cervix. These are called high-risk types of HPV. If these types of HPV are not found, you do not need any further tests. If these types of HPV are found, the sample is checked for any changes in the cells of your cervix. These can be treated to prevent cervical cancer. Myths about cervical screening. I only need a test if I have a symptom is a myth. Fact, screening detects early changes when there are no symptoms at all. Myth, it tests for all gynecological cancers. Fact, cervical screening only checks for abnormal cells in the cervix, not for ovarian, uterine, or other gynecological cancers. Myth, I don't need a test if I'm not sexually active or haven't had a new partner. Fact, the HPV can remain inactive in the body for many years, so screening is still needed even if you haven't been sexually active for a long time. Myth, the HPV vaccine means I don't need a screening. Fact, the vaccine does not protect against all high-risk strains of human papillomavirus that cause cervical cancer. Having regular screenings is still necessary. Myth, a positive HPV result means I have cancer. Fact, HPV is a common virus. A positive result means you have the virus, which is then monitored to prevent cancer from developing rather than detecting cancer itself. Myth, it will be painful. Fact, while it may cause minor discomfort, it should not be painful, and if it is, let the doctor or the nurse know. Breast cancer is the most common cancer in the UK. 56,000 women and 400 men get diagnosed annually. 1 in 7 women will suffer with breast cancer in their lifetime. The survival rate is good if it is caught early. However, breast cancer continues to be the leading cause of cancer death. Important facts about NHS breast screening program. It's a nationwide breast screening program for early detection of breast cancer in the UK. NHS breast screening is offered to women aged 50 years up to their 71st birthday. Everyone registered with a GP as female will be invited every 3 years. Breast screening uses X-rays called mammograms to check your breast for signs of cancer. Regular breast screening is one of the best ways to spot a cancer that is too small to feel or see. Finding cancer early can make it more likely that treatment will be successful, less likely you will need to have a breast removed or have mastectomy. You can have breast screening whatever size or shape your breasts are. Coming to myths and facts about breast cancer. Myth, underwire bras can cause breast cancer. Fact, underwire bras have not been found to cause breast cancer. Myth, deodorant can cause breast cancer. Fact, deodorants are considered safe to use. There are no current conclusive studies linking the chemicals in antiperspirants and deodorants to breast cancer. Myth, a lump in the breast is always a sign of breast cancer. Fact, lumps can be a sign of breast cancer, but most lumps found in or on the breast are usually not cancerous. Myth, only women can develop breast cancer. Fact, men and women can both develop breast cancer, not just women. Myth, breast injury causes cancer. Fact, breast injuries don't cause cancer, it can cause pain and discomfort. Myth, breast cancer is more common in women with bigger breasts. Fact, there is no relation to breast size and breast cancer. Myth, mammogram causes cancer or spreads it. Fact, mammogram doesn't spread cancer. The radiation used can cause rarely cancer. Myth, breast cancer affects only middle and old age women. Fact, breast cancer is common in middle and old age women but can be found in young women as well. Myth, if you have family history of breast cancer, you will get breast cancer. Fact, if you have family history of breast cancer, you are at higher risk of developing breast cancer, but most women who develop breast cancer doesn't have family history. Myth, if you have gene mutation BRCA1 and BRCA2, you will get breast cancer. Fact, not all women with gene mutation get breast cancer, but it does increase the risk of you having breast cancer.
Breast cancer awareness. Breast cancer is one of the most discussed cancer among women. What are the key warning signs and lifestyle factor that can help reduce the risk?
As I mentioned before, breast cancer is the most common cancer in the UK. 56,000 women and 400 men get diagnosed every year. 1 in 7 women will suffer from it in their lifetime. Breast cancer is the leading cause of cancer death. Hence, it is really important that we take steps to prevent breast cancer. You can prevent breast cancer by maintaining a healthy weight, by doing regular exercise, eating a healthy diet, limiting your alcohol intake to safe limits, which is less than 14 units per week, avoid smoking, breastfeeding your children, limiting the duration that you take the hormone replacement therapy, attending regular mammograms, which is organized through NHS breast screening program, by knowing your family history of breast cancer and also finding out if you've got the gene mutation BRCA1 and BRCA2 through your GP, taking time out to do self-breast examination, and if you find any changes, go to your GP for examination promptly. I would like to cover a little bit about the facts about NHS bowel cancer screening program. Bowel screening is not specific to women. Both men and women are invited. Bowel cancer is the 4th most common cancer in the UK. In England, Scotland and Wales, people between the age of 50 to 74 years are invited every 2 years to do a home stool test called FIT, or fecal immunochemical test, looking for occult blood. After 75 years, it's on request only. If stool occult blood is positive, patients are invited for colonoscopy. Screening aims to both prevent bowel cancer through the identification and removal of the precancerous polyps or adenomas, and to detect it at an early stage before symptoms have a chance to develop.
Contraception choices. Today there are many contraception options available. How can a woman choose the method that is safe and suitable for their lifestyle and health?
In the UK, the contraception services are free and accessible throughout the primary care, which includes GP surgeries, community pharmacy and sexual health clinics. Recently, the NHS has increased the license for the community pharmacies to initiate and manage the repeat prescriptions of oral contraceptive pill to reduce the pressure on the GPs. Women need to be aware of their choices of contraception throughout their fertility life. Coming to contraception choices, this is a list of various contraception choices to the women. Natural family planning, barrier contraception, which includes male and female condoms, diaphragm, oral contraceptive pills, which includes progesterone-only pill, combined contraceptive pill, hormonal contraceptive patch, hormonal vaginal ring, contraception implant, contraceptive injections, IUD or intrauterine device of copper coil, IUS or intrauterine system or hormonal coil, male sterilization, female sterilization, and emergency contraception. Come, let's look at this a little bit more in detail. Coming to the natural family planning, this includes tracking your menstrual cycle to avoid intercourse when you're most fertile. Barrier contraception works like a barrier so that the sperm and the ovum don't meet and fertilization doesn't happen. Diaphragm or cap is applied inside the vagina before intercourse to stop sperm getting into the womb. Male condoms are worn on the penis to help prevent pregnancy and sexually transmitted infections. The female condoms are applied into the vagina before intercourse to help prevent pregnancy and sexually transmitted infections. The combined pill is taken orally and it contains both progesterone and estrogen hormones. Progesterone-only pill, like its name, it has got only progesterone and it is called a mini pill. The vaginal ring is a soft, flexible ring put in the vagina which releases both the hormones progesterone and estrogen. Contraceptive patch is a sticky patch which is worn on the skin. For example, it could be your upper arm, back, thighs, etc., which releases both the hormones progesterone and estrogen. Coming to contraceptive implant, it's inserted under the skin of your arm and releases the hormone progesterone. Contraceptive injection is an injection that contains the hormone progesterone, and it is given intramuscularly every 12 weeks. Intrauterine device is inserted into the womb or the uterus, and it contains copper. Intrauterine system or hormonal coil is inserted into the womb and releases the hormone progesterone. Examples are Mirena coil, Kylena coil. Female sterilization is a procedure that permanently stops eggs meeting the sperm because either they tie or they cut the fallopian tubes. Vasectomy, or the male sterilization, is a procedure that permanently stops the sperm being ejaculated during intercourse because they cut or tie the vas deferens. Coming to emergency pill or the morning after pill, this is taken within 3 or 5 days after unprotected sexual intercourse, depending on the type of the pill.
Menopause and well-being. Menopause is a natural life stage which affects physical and emotional well-being. What step can women take to stay healthy during this transition?
So menopause is physiological. Every woman will go through it. Most women will go through it with less amount of symptoms, but some of them really struggle with it. Hence, it is really important that the women are aware of the perimenopausal and menopausal symptoms. It can affect their personal lives and also professional lives, so seek help early. Coming to menopause. The definition of menopause, according to the British Menopause Society, is menopause is defined as the permanent stopping of menstruation caused by the loss of ovarian follicular activity. It's a natural biological stage officially diagnosed after 12 consecutive months without a period. Typically occurring between the ages of 45 to 55, often accompanied by vasomotor symptoms like hot flushes and night sweats. Average age of achieving menopause is 51 years. So what is the definition of perimenopause? The phase before the menopause is characterized by irregular cycles which ends 12 months after the last period. What is premature menopause or premature ovarian insufficiency? The menopause which occurs under the age of 40, for which a blood test called follicle stimulating hormone test is advised, is called premature ovarian insufficiency. How do you diagnose menopause in women? Now, if women are over 45 years, it's mainly through clinical symptoms. No hormone test is required. GP might do other basic bloods to rule out other causes of women's symptoms. So, symptoms of menopause. The most common are vasomotor symptoms called hot flushes and night sweats. It is experienced by 70 to 80% of the women. They can have disturbed sleep, insomnia, low energy levels, low mood, anxiety, low libido, low sexual drive, impaired memory and concentration, a sense of brain fog, joint aches, headache, palpitations, vaginal dryness and urinary symptoms. In the long-term health conditions, they can also get thin bones or osteoporosis. Coming to the treatment of menopause, there should be a holistic and individualized approach in advising women, with particular reference to lifestyle advice and diet modification. There should be an opportunity to discuss the benefits and risk of their management options, including hormone replacement therapy and alternative therapies. Hormone replacement therapy, or HRT, is the most commonly used treatment for managing menopausal symptoms, and it has shown to be most effective intervention. The hormone estrogen is the main component of HRT, and it is effective in controlling menopausal symptoms. Estrogen can be given in the form of oral tablets or delivered through the skin transdermally in the form of patch, gel, or spray. Transdermal estrogen has a very neutral effect on the way the body breaks down the hormones, and it does not increase the risk of blood clots. Progesterone should be given to women who have not had a hysterectomy with estrogen replacement to protect the lining of the womb from the effects of estrogen and prevent endometrial cancer. Progesterone is replaced in the form of tablets or IUS, that is the intrauterine system, commonly Mirena coil is used. Testosterone in female replacement doses is effective in improving symptoms of low libido and low sexual drive. So, what are the lifestyle factors in menopause which can help the symptoms? Regular exercise, both aerobic exercises like cycling, jogging, swimming, and resistance training are important for muscle and bone health. Smoking cessation is another thing which, lifestyle factor which will help. Alcohol intake within safe limits. Diet which is less in saturated fats and salt will keep the blood pressure under control. Eating food rich in calcium and vitamin D is good for bone and muscles. Relaxation techniques like meditation and yoga helps to manage mood swings, and CBT is also helpful for the mental health symptoms of menopause. So the conclusion is women experience the menopause in different ways. Some women experience minimal or no symptoms going through the menopause. However, many women experience menopause symptoms that can significantly impact their quality of life. It can affect their personal life and also professional life. There should be an individualized approach in assessing women going through the menopause, with particular reference to lifestyle advice and diet modification, together with discussion about the role of HRT. All women should be aware that help and support is available. They should consult their healthcare professionals to access advice on how they can optimize their menopause transition and to understand what options they have to manage their symptoms.
Thank you, Dr. Shabari, for a powerful insight. Let's move on to our next segment, Rapid Fire Round. Short question, short answer. One thing women should know about contraception options today.
One thing women should know about contraception today is that it is an individualized choice. It depends on the indications, contraindications, patient's choices.
One piece of advice for women who's entering perimenopause.
One piece of advice for women entering perimenopause is that be aware of your body, be aware of the perimenopause and the postmenopausal symptoms, seek advice promptly and early.
One lifestyle habits that helps to maintain hormonal balance.
One lifestyle habit that helps hormonal balance during perimenopause and menopause will be regular exercises, which includes aerobics and weight training.
Screening or symptoms. Which should women prioritize first?
I would say both symptoms and screening. I know, Abhinandana, this is rapid fire questions. However, I would like to give a little bit of context to this. Now, if, for example, breast screening, if a woman who is younger than 50 does self-breast examination and finds a breast lump or a nipple discharge or an axillary lump, they should promptly go to the GP and get it examined. If a woman, say she's 52, she's had a mammogram when she's 50, she's waiting for her next mammogram, but when she does a self-examination of the breast, she finds a breast lump, she should promptly go to her GP. So women should engage actively with the screening program and also should be aware of the symptoms of various women's health conditions.
Thank you, Dr. Shabari Hosur, for your valuable insight and guiding us to such an important aspect of women's health. Your expertise not only educated us, but also empowered us to take care of ourselves and our families. To everyone who's watching this video, thank you for joining us on this session, and let's prioritize to take care of our health, break myth, and support one another. Thank you for watching The Specialist, bringing you expert insight from diverse professionals. This is Abhinandana Shetty, signing off. See you in the next episode. Till then, goodbye.